I'm Kris Kirschner with Community Health Network, and I'm honored to be here with all of you, but mainly to be sitting next to this lovely young woman here. This is Kasey, and Kasey is a new mother, but she also has another story to tell. And Courtney, as her nurse practitioner, who since the beginning has been her source of support, and so she wanted to be here as a source of support as well. Aren't these seats great?
They really are.
I feel like we need to sit down and turn around like The Voice, you know. We have our microphones, and if we have time, we did promise we would do a duet. I think Courtney's going to sing backup, so we'll take requests. So everybody knows, if you've had a child, what a life-changing experience that can be, and it was for Kasey for a number of reasons. So Kasey, let's talk about what happened on March 13th.
March 12th.
March 12th, excuse me.
It's okay.
All right, mid-March.
So started having contractions, which I thought were Braxton Hicks because my water didn't break, so I refused to go to the hospital. So I ended up having my daughter at my house. That was awesome. Sorry.
Okay, plant your feet.
I'm really nervous. Sorry, guys. And so my daughter came out, and then I went to the hospital, and it was life-changing. So. My daughter was born on March 12th. My sobriety date is March 14th. I'm a recovering heroin addict. Thank you. I used the entire time I was pregnant, so my daughter was born with NAS. She spent 2 months in the NICU, and she received some amazing care from this lady right here, and also the nurses that took care of her, Linnell and Cheryl, and Trisha and Heather, and the list goes on. So the last 8 months have been pretty amazing. My daughter's amazing. She's healthy and happy, and I'm extremely grateful for that. So thank you.
Kasey, talk about how this has been such an incredible journey for you, and a challenging one, I know, and you are such a woman of courage.
Thank you.
But how did it start?
It started because I got diagnosed with chronic migraines, and my doctor wrote me a prescription for Vicodin. And because it was prescribed to me, I thought it was okay. And so I started taking them as prescribed, and then I just started taking more and more. And then I couldn't get the effects anymore, so I had to go to something stronger. And so I was on heroin for 4 years. And I wanted to stop. I wanted to want to stop, but I could never stop. So I'm extremely grateful that I got pregnant because my daughter saved my life, because I don't think I would have stopped, and who knows where I would have been right now. But I'm not grateful for being an addict, but I'm grateful because it's made me stronger. It's made me a better person. I think it's made me a better mother. It's made me a better daughter. So I'm just extremely grateful. So.
And you do have quite an extensive support system, but we had talked about this before, and you said you were afraid to tell anybody.
I was an addict's mind. I don't know. I thought everybody would stop loving me. I thought my parents would hate me, my boyfriend would hate me, all my friends would hate me, and that I'd have nothing. Because my addict mind, I wasn't worthy of their love because I was an addict. Which is just crazy now that I'm sober and I can really think, like, my parents would never stop loving me, my friends would never stop loving me, but that's what the drug does. It makes you think that you're not good enough for anything or anybody. So
walk us through that journey for you. So you found out you were pregnant. What happened? I mean, in terms of what you felt like you needed to do and how to go about it.
I knew I needed help, but again, I was scared to tell anybody. I didn't want anybody to stop loving me, so I hid it. I hid it for a long time. I mean, I didn't find out I was pregnant until I was 5.5 months pregnant. But at that point, I had used for so long that I knew I couldn't stop. And so I just kept using. And it was scary because every day, like, I wanted to stop so bad for my daughter and for my family and for me, and I just couldn't. And it was terrifying. It was terrifying. That's the best word to describe it. But the day that she was delivered, it was almost a relief because I knew I couldn't hide it anymore. I knew that it was all going to come to light and to the surface. And like I said, it was a sigh of relief because I knew that I was going to be able to get the help that I so desperately wanted that I couldn't ask for myself. So.
And Kasey, you have a medical background, I mean, in your profession. Let's talk a little bit about that.
Yeah, so I'm a nurse. Obviously, I'm not nursing right now because that's not where I need to be. I don't need to be around that kind of stuff. But yeah, I went to nursing school and worked as a nurse for 4 years, and I saw it, and I was around it every day. And it just goes to show that there is no discrimination. I mean, this is everywhere. It hits anybody and everybody. And it's really scary to realize that. But it's everywhere. It's an epidemic. And it's extremely frightening. So, yeah.
So your little girl, Isabella, comes into this world with a full head of hair.
Yeah.
She's a beautiful girl. And you said she saved your life. You also got a lot of care, a lot of support, I know through community, for one.
Mm-hmm.
You talk a little bit about that.
Yeah, so the nurse that was taking care of me was hellbound on getting me into a treatment center, and she worked her butt off to get me in there. And I literally delivered. 2 days later, I was in a detox center. 6 days later, I was in a sober living. And I was in sober living for 6 months while my daughter was in the NICU. But the care of the nurses at Community, I will never forget. Like, there are no words to describe how much they mean to me and how grateful I am for them, because they saved my life as well as my daughter's. So,
Courtney, let's talk to you. I know you didn't want to talk a lot, but I want to give Kasey a break here. God love her. Talk a little bit about Kasey and what was so important and what the kind of care that she received and how she was willing to receive it. Talk a little bit about that.
I think in the beginning she was afraid still to tell anybody, but it came out pretty quickly, and it was a shock to her family. It was a shock to her whole support system, but everybody rallied around her. We see a lot of babies with neonatal abstinence syndrome at Community East, and there's absolutely no judgment whatsoever in treating these families. And it's not just treating the babies, it's treating the families as well. So we wanted to make sure that she felt safe, knowing that her daughter was safe and that there was no judgment and that her daughter was going to get the care that she needed. And while she was getting treatment, her extended family came and visited Izzy, which is what we call her, short for Isabella. And we educated them and supported them through it as well. Isabella became part of our family at Community East, and we all love her very much. She comes back to visit quite frequently. We get updates quite frequently from them, and she's one of our success stories. I have to say that we have a lot of neonatal success stories, but unfortunately not a lot of maternal success stories. And Kasey is one of the strongest women I know. She has persevered through a lot of hardship, and we're very, very proud of her at Community East.
You mentioned two things, education and no judgment.
Mm-hmm.
Two things I'm sure in these situations are extremely important.
Mm-hmm.
Would you agree?
I agree. I think a lot of the reason that some of our families don't ask for help prenatally is because they're fearful of judgment. I think a lot of them want help, but they're fearful of the judgment from family, friends, medical professionals. And we're just very clear that we're there to help them. We're not there to take their children away. We're not there to punish them. We are there to help them and their babies get healthy and provide them the education and the support that they need and the medical care that they need. And we have a fantastic program now at Community East that's starting prenatally with moms, which I think Kasey wished she probably would have been a part of, but she's done it despite her hardships. So.
So Kasey, let's talk moving forward. And I know it's a hope for you that other people who might be in similar situations get this kind of help. Can you talk a little bit about that, what your hopes are?
Yeah, like I said, I was extremely blessed to have the team that I had to help me. And I see it every day. People are dying from this, and it's extremely sad. And the sober living that I lived at, I mean, we had the girls that were relapsing every month. And it's sad, and it breaks my heart because I wish they had the support that I had and the team that I had to help me. And I want so desperately for people to get help because I don't want people to die from this anymore. I don't want my friends to die from this anymore because I have friends that are still on it. Some of my best friends are still on it, and I can't see them and I can't hang out with them because of it. And I just so desperately want them to get the help that I got. And it's a shame that it's not readily available to everybody like it was to me. So
I'm sure you still have struggles along the way.
Yeah.
What gets you through it? What gets you through each day? What gets you motivated to get up in the morning and to stay motivated?
So I'm going to be an addict for the rest of my life. It's a disease, there's no cure, and it's something that I live with every day. But I don't let it stop me. I have a beautiful daughter that I have to take care of, and I want to be the best mother that I can be. I want to prove to my family for the disappointments that I put them through for the last 4 years. I want to prove that I can be the best person that I can be and the best mom that I can be. And so that's just what gets me going every single day.
So can we bring Izzy out?
Yes.
Would you like to meet Izzy? She's a beautiful little girl. Let's bring her out. I know she'll bring you a little bit of comfort as well. I mean, look at that head of hair. Have you ever seen such a thing? So she is healthy and happy
Yes.
and growing.
She is. She has her own personality. She can crawl. She stands up. She gets really angry if she doesn't get her toy right away. She's amazing, and I'm extremely grateful.
And when you look at her every day, does that,
Yeah.
tell me what,
I fall in love with her even more every single day. It's the love of a mother is undescribable. My mom always told me about it, and I'm just like, okay, Mom, whatever. and then I have her, and I totally get it. So.
well, I just want to tell you, thank you. It's not easy to just get up in front of a crowd for any reason, but to get up in front of a crowd and share the story that you have to share in the hopes that you're going to be helping other people takes such tremendous courage.
Thank you, and I hope that my words do say, help somebody somewhere. I talked to my sponsor about this because I was freaking out, and she was like, you never know who you can help, who you can touch. Your words might help somebody, they might save somebody, so I really hope that my words do. So.
And there's not a doubt in my mind that they have. So Courtney, thank you for all your wonderful care as well.
And I just wanted to introduce, so this is Linnell. She's one of the labor and delivery nurses that's Community East, and became very close with Kasey and very instrumental in her recovery as well. And this is Trish. She's one of our unit secretaries. And again, that just goes to show you how close our unit is and how supportive they are in helping all of our patients. We're all a very tight-knit family now.
And thank you all so very much. Could you please thank them for being here this morning, and thank Kasey for her wonderful, inspiring story.
Thank you very much.